immunity. We have two types of immunity, mainly based on the response, active immunity and passive immunity. So in this active immunity, so first one is the humoral immunity. So humoral immunity is mainly the antibody mediated. So antibody mediated immunity that will be produced by the B cells. And other one is the cellular immunity, that is cell mediated immunity, that is by T cells, and combination of both of these humoral and cellular immunity. So first one is the humoral immunity, then second one is the cellular immunity, and third one is the combination of the above that comes under the active immunity. The other one is the passive immunity. So as you all know, like passive immunity, that what we are giving from outside. So first one is the normal human immunoglobulin. So normal human immunoglobulin, like whenever there is an immunocompromised patient or whenever there is an autoimmune disorder patient, so the immunoglobulin that is derived from other humans that will be injected into the autoimmune disorder child. So mainly some bare lymphocytic syndrome child. So this human IV immunoglobulin can be used. And also in like recently in after COVID, so the children are getting affected. So when the children was affected, that post-COVID effect will be there. Like that will be like a Kawasaki disease. And in such cases, they will be administering IVIG. So that is the normal human immunoglobulin will be injected. So the other one is the specific human immunoglobulin. Specific human immunoglobulin is like whenever the child is or whenever a person is getting infected to some infections like hepatitis B and also like tetanus. So they will be giving some specific immunoglobulin for the specific disease like hepatitis B immunoglobulin or tetanus immunoglobulin. The other thing is the animal antitoxins and anti-sera. So animal antitoxins and anti-sera that will be derived from the animals other than the humans. So these are the immunity that will be based on the response. So next we will be seeing in detail about what is humoral immunity, what is cellular immunity, and what is the combination, like what is the immunity that occur by the combination of above the humoral and cellular immunity. So as you all know that humoral immunity is mainly antibody mediated. So that will be derived from the B cells. So these B cells were that will be originating from the bone marrow. So these antibodies, usually in humoral immunity, these antibodies will be directly activating into the like humoral immunity that comes from the B cells, and the antibodies will be present in the immunoglobulin fraction of the serum. The antibodies usually it will circulate in the body and attach to the antigen. So once it attaches to the antigen, it neutralizes the microbes. So this will render the microbes to be susceptible to attack by the polymorphonucleonucleoside and the monocytes. And these antibodies will react to the same antigens and they will produce the effect. So this is about the humoral immunity. And next one is cellular immunity. So these cellular immunities will be mediated by the T cells. So the T cells are produced in the bone marrow and the maturity will be happening in the thymus glands. Usually these T cells that will does not secrete the antibody, but that will directly attack the antigen. It will recognize the antigen and it will attack the antigen directly. So there will be a protective immune response. That is like once this antigen enter into our body, our phagocytic properties will be getting activated and then like release of cytokines will be happening. So that like inflammatory response will be happening and these antibodies will destroy the virus and it will eliminate the virus or any antigen from our body. So these cellular immunity that will mainly play a role in cancer cell and also this will act in transplant rejection also. So it will be play a major role in the delayed transplant rejection. So the next one is the combination of the both. So combination of the both means both the B and T lymphoid cells will cooperate each other and that will identify the antigens and that will act against it. So the T helper cells will produce the antibody and T suppressor cell will inhibit the globulin synthesis. So these are the active immunity. So how our cells is responding and how it is fighting and how we are acquiring the immunity through these humoral, cellular and combination of the above. So I think you can able to understand this. So the same thing I have picturized here. So whenever an antigen is entering into our body, it will be like a story. So just remember like a story. So our body will be acting like a first line of defense. So first line of defense mainly the skin, mucous membrane and the gastric intestinal tract, mainly the stomach acids. So these will recognize once it recognizes the foreign body or any antigen that we are acquiring from outside. So this surface barrier. So this will be calling as a surface barrier or physical barrier. So this innate immunity that will be acquiring by birth itself. So inborn immunity which we have in our body that is present externally. So once it is identifying some foreign body or some antigen, this will release some chemical secretion and this will restrict the growth of microbes. So this is the first line of defense. So if this first line of defense is successful, so there is no issue in our body. We will not get any disease or anything. And if the first line of defense is failed, the body will enter into the second line of defense. So here the chemical barrier will come. Okay. And the chemical barrier, once it comes or once it fails, our body will respond, our cell will respond, and there is cellular response or molecular response will occur. And here the main things which will act is like sweat, sebum, tear glands. So these glands mainly that will release, like mainly once this in the second line of defense, our WBC, mainly the T cells will activate and these phagocytosis properties will occur. So mainly in the second line of defense only, phagocytic property will occur. This leukocytes, mainly the WBCs will migrate to the infection site and it will engulf the foreign body, that is phagocytosis. Phagocytosis means once antigen enters in our body or once the foreign body enters in our body, the WBCs will migrate to the infection site and it will engulf the foreign body. So this is engulfing of the foreign body. So this is the second line of defense. Then the third line of defense is the acquired immunity. So the second line of defense also failed. So our acquired immunity will happen. So the both B cells and T cells will together act in the third line of defense. So B cell is responsible for the production of antibody. So these antibodies will act, as I said, in humoral immunity, how it acts. And then in third line of defense, T cells will also act. So these T cells that does not produce antibody, but it will act directly to the antigen and it will try to eliminate the antigen. So this is what happened in the third line of defense. I think you have understood about this. So what is the first line of defense? What is second line of defense? And what is third line of defense? Just to remember like a story. So you have a body, in that outer skin is there. Once antibody, once antigen enters in our body, what it happens? And if it is failed to eliminate that antigen, the second line of defense occurs. So here mainly the phagocytic property will happen, and when it fails, when cellular barrier fails, we will go through the third line of defense. In that only that antibody will act. So B cell will produce antibody and T cell will eliminate the antigen by directly acting to the T cell. So this one I have for your understanding, just I have put this column. So humoral antibody is antibody mediated, cell mediated or cellular is T cell mediated. So the site of activity will be in the extracellular fluid, mainly in humoral, mainly the extracellular fluid, and this cell mediated will be the location of the antigen present in tissue. And here, as I said already, humoral immunity will be mainly by B cell and cellular immunity mainly by T cell. And in humoral immunity, the speed of onset will be fast. So whenever our body is detecting the antigen, the B cells will act fast, but cell mediated or cellular mediated will be slow response. So the antigen type in humoral immunity will be extracellular, that is from outside. And this antigen type in cellular one is intracellular. So the method of removal will be like we are neutralizing. So antibody will neutralize it. In cellular mediated or cell mediated one, there will be cellular lysis. It will destroy the cell and it will eliminate the antigen. So these are the difference between the humoral and cellular immunity. So I have a question for you here. So a person is infected with a virus that primarily targets and destroy the helper T cells. So here a person is infected with a virus and that will target and destroy the helper T cells. Which aspect of the immune response is most directly affected by this viral infection? So the option here is activation of B cells, activation of cytotoxic T cells, activation of natural killer cells, activation of memory T cells. Just write the answer in your chat box. Go through the questions carefully, read it carefully and answer your. So I will reveal the answer now. So first is activation of B cell. The correct answer is activation of B cells. So once any virus enters into our body, the fast response will be by the B cells. So any virus or any antigen, once it enters into our body, our B cells only will activate first. That is, the fast response will be done only by the B cells. So immediate response will be by the B cells. So the other types of immunity that will be classified based on the nature is active immunity and passive immunity. So active immunity means again classified into two types. That is the natural active immunity and artificial active immunity. So natural active immunity is the innate one that will be occurred either through our inborn nature or either it will be occurred through an infection. So after getting an infection, we will get an immunity that is the natural active immunity. And artificial active immunity is through the administration of any vaccination. So definitely you will be getting a question and that question will be a tricky one too. So they will be they will give an example and they will tell what type of immunity is this. So it is natural active immunity or artificial active immunity, like that. Sometimes you will be getting confused questions. So you have to be very careful with this. So next one is the passive immunity. So passive immunity also, it has two forms, natural passive immunity. The other one is artificial or acquired passive immunity. So natural immunity will be through the maternal antibody and the artificial one is through hyperimmune serum. So I will explain about what is active immunity. So active immunity that will be developing as a result of an infection. As I said in the like a picturized form, it will be occurring as a result of an infection or by a specific immunization or vaccination. So once any infection or once any vaccination is administered, the immune system will be stimulated by that antigen to produce the antibody mediated or cell mediated immunity. So the immune system will be stimulated to produce the antibody mediated or cell mediated immunity. And this active immunity will be lasting for more than years or even for a lifetime. So how we are acquiring or how we are getting this active immunity is through an infection. So that infection can be a clinical infection or a subclinical infection. So clinical infection either in the form of a chickenpox or rubella. Subclinical infection will be in the form of a polio or diphtheria. And active immunization that is occurring through immunization is the artificial one. So artificial active immunity or acquired active immunity that is following an immunization. That can be either through a vaccine or a toxoid. Have you clear with this one? So this is about active immunity. So the first two things, clinical infection and subclinical infection, these two will be coming under natural active immunity, and these following immunization, it will come under the artificial or acquired active immunity. So the next one is passive immunity. So this passive immunity, here the antibodies produced in one body, that is either from a human source or from an animal source, that will be processed in a lab and that can be transferred to another body to induce protection against any diseases. Usually the body will not produce antibody, but it will depend on the ready-made antibodies. It will provide only temporary protection. So as I said, passive immunity will give only the temporary protection. It won't give lifelong protection against any infection. So this passive immunity can be administered either like antibody containing preparations like immunoglobulin or antisera, or the antibody will be transferred from maternal antibodies through placenta or through human milk, mainly cholesterol. And then by transfer of lymphocytes to induce the passive cellular immunity. So here in some countries, they will transfuse lymphocyte for stimulating the cellular immunity. So in this passive immunity, these maternal antibodies, when these antibodies are transferring to placenta, so this one is called as natural immunity, natural passive immunity. This will not produce lifelong immunity. So these antibodies crossing through placenta will protect the newborn only for a limited period. But when we are administering the antibody through an immunoglobulin, this is called as acquired passive immunity. So this is natural one and this is the acquired one. So this will be about the passive immunity. So I think you all clear with this passive and active immunity. So this is another one difference between this active and passive immunity. So active immunity is fast, passive immunity is slow, and it will provide immediate response and it will provide delay response. The antibody will be produced in the host body. We will not producing antibody outside the body. Here in passive immunity, they are administering the ready-made antibodies which is processed outside. This will provide a immunological memory. Immunological memory means like whenever we are getting chicken pox, that will be a lifelong immunity for us. So if you are going, like once you are infected with the chicken pox, and another time if you are going to a patient affected with the chicken pox, you will not get that infection suddenly, because our cell will be remembering that already we have got that infection and that will remember to fight against it. So we will not get in this repeated infections, we will not get it. And passive immunity will not provide immunological memory. Active immunity is long lasting and passive immunity is short one. So just I have summarized this active immunity and passive immunity. So this is the picturized form of this. So active immunity is we are getting through an infection or through a vaccination. So this is naturally acquired one and this is artificially one. Passive immunities, this is natural through maternal antibody, and artificial is through an antibody that is prepared from outside, either through an immunoglobulin. So there's a question for you. So a person is bitten by a venomous snake. Which type of immunity is most directly involved in countering the effect of the venom? So the options are active immunity, innate immunity, humoral immunity, passive immunity. So innate is natural one. So active immunity or innate, humoral or passive immunity. So this is venomous snake. So you can chat your answer in the chat box. So the answer is passive immunity. So we are extracting the antibody from the outside one. So antibodies we are extracting from an animal source and we are injecting into the body. So that is passive immunity. So thank you for the answers. So the other type of immunity which is commonly used mainly for polio, as you all heard that herd immunity. So herd immunity is also known as a population immunity. So here we are not directly immunizing the patient, or we are not giving vaccine. In this concept of herd immunity is certain group of person in a population will be immunized, and their focus is like to prevent infection or some like protection, to give protection to the other group of population. So example in polio, so they will be giving intensified polio vaccine, like pulse polio program. The main objective is like they will be selecting certain group of population, like under the age of 5 years, they will give, and the transmission of polio will be like fecal oral route. So once we are administering the polio, that will be going through the GA tract, and that vaccine, some amount will be eliminated to the fecal matters. So in case of people using the open defecation, like this will be contaminated through water. Like once this contaminated through water, if some people are drinking that water, that will be giving a protection. So that is called as herd immunity. So that type of immunity is herd immunity. So herd immunity is also known as a population immunity, and it will give a direct protection that applies only to the contagious disease. So it occurs when a sufficient percentage of population has become immune to an infection, whether through previous infection or vaccination, thereby reducing the likelihood of infection for individuals who lack the immunity. So this is herd immunity. So that they tried herd immunity for COVID also, but they couldn't achieve it. So I think you all understood about the immunity, the concept of immunity, what are the types of immunity. So we will next move on to the other topic is immunization. So this immunization, you will be getting at least one question in all your exams. At least 1 or 2 questions you may get. So this immunization is the process, as you all know, like we are administering vaccine. That is immunization. So it is a process whereby person is made immune or resistant to an infectious disease, mainly by the administration of any vaccine. This vaccine will stimulate our body's immune system, and that will protect the person against subsequent infection or disease. So it is a proven tool for eliminating and controlling the life-threatening diseases. As you all know that vaccine have eliminated mainly 2 diseases from the, like mainly 1 disease from world. What is it? I think you all know, like smallpox. And in India, they have eradicated polio also by means of this vaccine. So vaccine is a powerful tool for controlling and eliminating the life-threatening disease. Even they have tried with COVID also, as you all know. So these immunizing agents are classified into vaccine, immunoglobulin, and anti-serum. So the immunizing agent mainly contains vaccine, immunoglobulin, and anti-serum. So we will see first about what is vaccine. So it is an immunobiological substance that is designed to produce specific protection against the disease. It will stimulate the production of protective antibodies and other immune mechanisms. So it is an immunobiological substance that will be mainly designed for the protection against diseases by stimulating the production of antibodies. So there are 5 forms of vaccine, that is live vaccine, killed vaccine, toxoid, as you all know, cellular fraction, and combination of the above. So these are the 5 forms of vaccine: live vaccine, live or inactivated, toxoid, cellular fraction, and combination. So there's a question for you. Who invented vaccine? You can chat in the chat box. Who invented vaccine? I think this is a common question you will get from your first year itself. So this can be, you will get this question even in your NORCET also. So who invented vaccine? I have not put option, just it's a direct question. So it is Dr. Edward Jenner. So he is the person who invented vaccine, and the first vaccine he invented is the smallpox, and he is successful with that. And like it is tried to say that he have invented a vaccine to eliminate the or eradicate the smallpox. So So there is another one question. When smallpox is eradicated in India? So if anyone can know, you can chat in your chat. You can put your answer in the chat box. When smallpox is eradicated in India? So it was eradicated in the year 1977, and WHO declared that India got eradicated the smallpox in April 23rd, 1977. So the next one is, what is live vaccine and what is killed vaccine? So
you connected way.
Am I audible to you?
Yes, ma'am. Your voice is audible, ma'am.
So first we'll see about what is live vaccine. So live vaccine is that will be derived from wild virus or any bacteria, and this vaccine will be live only, but the virulence will be weakened or attenuated in the lab by repeated culturing. So it will replicate in the body. Once we are administering this vaccine, live vaccine in the body, it will replicate in the body, or it will multiply in the body, and it will create enough organism to stimulate the immune response. And these live vaccines, it should not be administered in the immunocompromised individuals. So these live vaccines, we have to be very careful. We should not be administered in immunocompromised individuals, like whoever is taking chemotherapy drugs, and in case of leukemia and in case of necrotics, you have to be very careful in administering this live vaccine, and it should not be administered also. So this is about live vaccine. And in killed vaccine, that is be also derived from wild virus or bacteria, but these organisms will be killed by heat or chemicals before injecting into the body to stimulate the immunity. These vaccines are not live, and it will not multiply or it will not replicate. This will not cause any disease, and it can be administered in an immunodeficient individuals also. So this killed vaccine is safe for immunocompromised patients or individuals. So these are the characteristics of live vaccine. The number of doses in live vaccine and killed vaccine, and the need for adjuvants, duration of immunity. So just go through it. So in killed vaccine, we have to put multiple doses, but in live vaccine, only single dose. The duration of immunity in killed vaccine will be shorter, but in live vaccine, it will be longer. Just go through. Need for adjuvant. Killed vaccine, we need adjuvant. So adjuvant is the vaccine supportive things which we are adding in vaccine. Okay, just go through it. This I have taken from Park textbook only. So the common vaccines. So based on the organism, I have classified this one. So bacteria, virus, and ricket. So the live vaccine, the bacterial live vaccine are BCG, typhoid oral. Then killed vaccine is cholera, meningitis, pertussis, plague, typhoid. So here in this also you will get at least, you may get one question. So they will give some vaccine, and they will tell what type of vaccine is this. Other they will tell they will ask what is the live vaccine in this group of vaccine. So they will write, they will ask such type of question also. So just go through it. Virus, the live vaccine will be rubella, oral polio, mumps, measles, influenza, chickenpox, and yellow fever. Killed will be rabies, influenza, SARS, KFT, Kaisinovirus disease. Then hepatitis A and B, Japanese encephalitis. And you all know that Japanese encephalitis is not, Japanese encephalitis and yellow fever is not in our immunization schedule. It is in the immunization schedule, but mainly we are administering in the endemic area only. And this yellow fever also, whoever is coming from foreign, mainly from South Africa, if they are finding, they will be administering this yellow fever vaccine. So the other type of immunization which we are giving is toxoid. So some organisms will produce exotoxin, mainly the diphtheria and tetanus. And these toxins or exotoxins will be deactivated in the preparation of vaccine. And once we are administering this toxoid in the body, it will produce antibody, and that will neutralize the toxic moiety. Moiety means that will the half of the organism's toxicity will be The toxin preparation are highly efficacious and safe immunizing agent. So the other question for you is, a pregnant woman is advised to receive a DT vaccine during her third trimester. Which component of the vaccine provides protection to both the mother and the newborn? So a mother is advised DT vaccine, and that vaccine will provide what protection? So inactivated bacterial toxins, live attenuated virus, inactivated bacterial cells, or recombinant DNA. The answer is inactivated bacterial toxin. So the other question is, a child is born to a mother with hepatitis B. To prevent viral transmission, what intervention is recommended for the newborn? So child is born to a mother with hepatitis B. So what vaccine or what intervention he will produce? A child born with hepatitis B can be fed after giving some vaccine or some immunoglobulin. So what is the answer? So DPT vaccination, BCG vaccination, hepatitis B vaccination, and hepatitis B immunoglobulin. So the answer is C. The other thing is cellular fraction. So that is prepared from the extracted cellular fraction like meningococcal vaccine from the polysaccharide antigen of the cell wall, and pneumococcal vaccine from the polysaccharide contained in the capsule of the organism. This pneumococcal vaccine is newly included in our vaccination or immunization schedule. And hepatitis B polypeptide vaccine. So these are from the cellular component of that infection. The other thing is combination. So combination means one or two vaccines or toxins will be added together so that it will be easy or simplicity in administration, and that will reduce the cost, and it will minimize the number of pricks in the newborn or any adult. So that is mainly DPT, DT, DP, and MMR. And combination is adjuvants. So adjuvants are the helping substances that are added to the vaccine to the intent of potentiating the immune response. So when adjuvants are added to the vaccine, that will potentiate the immune response, so that greater amount of antibody will be produced. So the main adjuvants that are used in our vaccination is aluminum phosphate and aluminum hydroxide and water in oil. So these adjuvants are a helping agent to stimulate the potentiality of the immune response, or it will stimulate the production of more antibodies. So the next one is immunoglobulin. So as you all know, it is a Y-shaped protein that is mainly produced by the B cells. So in our body, it is mainly composed of 5 classes: IgG, IgA, IgM, IgD, and IgE. And it will also have some subclasses. So the main and immunoglobulin are G, A, M, D, and E. So the immunoglobulin, what are the functions of this immunoglobulin, we will see in detail. So this immunoglobulin G. So the percentage in serum is 85%. So it is the largest one in our serum, and the half-life is 10 to 21. It is mainly found in the blood, lymph, and intestinal fluid. It is active against bacteria, toxins, and viruses. And this and the immunoglobulin will enhances the phagocytosis, and it will crosses the placenta and is active in a second response. Then immunoglobulin A, the percentage in serum is only 15%, and half-life is 6 to 8 days. It mainly found in body secretions like saliva, milk, colostrum, tears, bronchial secretion, nasal mucosa, and it will provide primary defense at the mucous membrane against the local infection. So it is the one which is providing primary defense mechanism at the mucous membrane, and it will prevent the absorption of antigens from the food and protect against respiratory. So it is found in mainly in the mucosal tissue. And then immunoglobulin M, the percentage in serum is 10, and it is mainly found in the blood and lymph. And this antibody that is promptly forms in response to antigen, and it is high concentration in early infection. This immunoglobulin will be present in a high concentration in early infection. Then immunoglobulin D, less only in serum. mainly found in the blood and lymph. Then as you all know, immunoglobulin E is found in the mast cell and basophils, and it is responsible for the hypersensitivity reaction. So just you go through it. What is the function? Mainly immunoglobulin G, A and E has a function in our high function in our body. So the other question is, what is the immunoglobulin that crosses the placenta? No option in this question. Just answer your answer it in your chat box. What is the immunoglobulin that crosses the placenta? So we'll see the answer. So as I said, it is immunoglobulin G. So immunoglobulin G is the one that will cross the placenta. So the other question is, so the immunoglobulin that is present in the colostrum. So you can answer it. Immunoglobulin that is present in the colostrum. So it is immunoglobulin A. So sometimes it will be, they will give the option like secretory immunoglobulin A. The other thing is anti-serum. So anti-serum, it will also contain immunoglobulin that will be derived from another human or animals inoculated with an antigenic material. So it is a passive immunization. Mainly it will be against diphtheria, botulism, gas gangrene, and snakebite. This administration of anti-serum may cause serum sickness. In rare cases, it will cause serum sickness and even anaphylactic reaction. As you all know, like in case of, if you are giving anti-snake venom for snakebite cases, they will be getting anaphylactic reaction. So some will be sensitive to that. So we have to monitor closely when we are administering any immunoglobulin or any anti-snake venom that is extracted from outside person or some animals. So once we are administering, even in case of immunoglobulin IVIG and also in case of ASP, we have to be very careful while administering this anti-serum. So the other, in immunization, the main important thing is the cold chain. So the cold chain, what is cold chain? As you all know, like it is the maintaining of the cold chain in the vaccination manufacturing site as well as the administration site. So it is the system of transporting and storing vaccines within the temperature range of 35 °F, that is mainly 2 to 8 degrees Celsius. And also in deep freezer means -20 °. So the cold chains begins when vaccine is manufactured, moves through the state distribution center and ends with the local immunization provider at the time of administration. So we have to maintain that temperature from the manufacturing site to the actual service provider or actually whoever is receiving, that is cold chain. So in India, we have this system, vaccine cold chain distribution network. First is the vaccine manufacturing site, and that once the vaccine is get manufactured, so that will be transported through air media. Then that will be stored in a primary storing area. So we will have a walk-in cold room. So the temperature will be 2 to 8 degrees, and walk-in freezer. So in case of any vaccine to be freezed, that should be in a -15 to -25 °C. So this is the primary store. Walk-in cold room, the vaccine should be 2 to 8 degrees, and in case of freezer, it should be -15 to -25 degrees. And then from the primary store, that should be transported through a refrigerated or insulated van. In that also, we have to maintain that temperature, and that will be stored in a regional vaccine center. So that can be in a state or a district level. And from that, this will be a state level, and then it will be transported through an insulated van to the district vaccine center. So this district vaccine store will have a deep freezer and ILR. So in district, they will not have the walk-in cold room. They will have only the ILR and deep freezers. Then that will be transported through an insulated van to the primary health center, urban health center, and community health center. And that vaccines will be stored in the ILR, Iceland refrigerator only. They will store the vaccine. And from primary health center and community health center, that vaccine will be transported by the village health nurse or ashas and local health guides, and they will transport that vaccine through a vaccine carrier. So they are the person who is administering the vaccine through the sub center, or even in PHC they will administer, or in this community health center also they will administer. So that will be going to the target group. So this is cold chain from the manufacturing to the target group. So they will have a cycle. Mainly, first one is air transport, then primary store in walk-in cold room, then regional vaccine store, and from there district store. Then from district, they will be sending to the GH, primary health center, community health center, and from there through vaccine carrier to the sub center. So have you all clear with this one, cold chain system? So this walk-in cold room, as I said, that is in the regional level. So this will store vaccine up to for 3 months. They will store the vaccine. So this walk-in cold room will serve for 4 to 5 districts. So this is the regional level. So in state they will divide into regional, and in that regional they will store vaccine for 3 months, and it will serve for 4 to 5 districts. And then deep freezers and ILR. So deep freezer, the capacity will be 300. You will be getting a question with this also. So what is the capacity of a deep freezer in the district level, and what is the capacity of a deep freezer in the PHC level? Like that, you may get questions. So this deep freezer capacity will be 300 liter at the district level, and ILR will be 300 or 240 liter. And then these deep freezers are mainly used for making the ice pack. And in deep freezer, we will store mainly 2 vaccines, mainly OPV and measles vaccine. You have to know that. So this should be stored at the deep freezer at -20 degrees Celsius. Then small deep freezers and ILR, it is 140 liter one. That is will be available in the primary health center, urban family planning center, and the postpartum centers. And these deep freezers will also be there to frozen the ice packs to be used in the cold boxes or vaccine carrier. So the other thing is cold boxes. So you all know about cold boxes that will be available in the periphery centers, mainly for transportation of vaccine. And they will have an ice packs that should be placed in the cold box at both side and bottom. And their vaccines will be kept in polythene bags. So I think you all know about it. You all have gone for a pulse polio immunization program, and in your community also they will be using this in primary health center and sub center also. How they will pack and how they will keep the vaccine, I think you all have witnessed it. So vaccines of DPT, DT, and DT and diluent should not be in direct contact with the frozen ice packs. So whenever you are keeping a vaccine in cold box or in an ILR, you should be very careful that you should not keep the container or vial in directly in the freezer or in the ILR. It should be kept in a polythene bag. Then other thing is vaccine carrier. So that should be taken by the village health nurse in the area. It will mainly to carry a small quantity of vaccine, mainly 16 to 20 vials. And then day carriers will be carrying only small quantity of vaccine like 6 to 8 vials. And it will have only 2 fully frozen packs and is used only for the few hours. So if they are using vaccine for few hours, or they want to carry for a small distance only, they have to take the day carrier, because it will have only 2 frozen packs of ice. So this is about the cold chain system. So the next is about the ILR. So what is ILR? As I said, you all know about what is ILR, and you have seen this ILR in the primary health center, community health center, and in maternal health center also. So how you will arrange these vaccines? So this measles and OPV will be arranged in the freezer compartment. So these 2 will be in the freezer compartment. So that should be stored at -20 degrees Celsius. Polio and measles should be stored in the freezer compartment, and other thing, the diluents and other vaccines should be stored in the upper part. So these all will be in the upper part, and the degree will be 4 to 8 degree, and they will have a thermometer for recording this temperature of this ILR. Then what is the do's and don'ts in ILR? So when they are installing an Iceland refrigerator in a PHC or a community health center, what we have to know, what all we should do and we should not do. So first one is we have to keep in a cold room away from sunlight. That should be in a dark room, not exactly a dark room, that should be away from a sunlight. And it should be 10 centimeter away from the wall, and the equipment should be at the level. So we have to be very careful that surface should be at a level. Fix equipment through a voltage stabilizer so that there will not be any disturbances in the fluctuation in the electrical power. Then arrange vaccines neatly, so with the space between the stocks for air circulation. Then you have to lock the ILR and you have to open only when necessary. And that should be defrosted periodically, and we have to record the temperature, and there will be a they will have a register to record the temperature also. Then don't keep any object over the equipment. Over the ILR, we should not keep any equipment, and we should not store any other drug. And we have to do not keep drinking water or food, and don't keep more than 1 month requirement at the PHC level. At the PHC level, we should purchase only for a 1 month procurement should be made, and more than that we should not get. Then do not keep the expired vaccine also in ILR. So this is about the ILR. So the other thing is vaccine vial monitor. So this you may get some picturized form of question. When to use vaccine? So before administering a vaccine or before withdrawing a injection from vaccine vial, we have to see the BVM monitor. So you all have seen in polio vaccine. So this is the outer circle and this is the square. The outer circle will be like dark purple color and the inner square will be white in color. So this means that we can use the vaccine. So this is safe to administer. And when the square color and this circle color is almost equal, we should not use it. So this should not be used. This can be used. And this also, see, almost both the color are same. So we should not use this. So the inner square should be white. And if this inner square is getting faded gradually, we should not use this. So this is vaccine vial monitor. And this should be reported and it should be discarded immediately. So there one more question for you. A healthcare worker notices that a vaccine vial has been accidentally frozen. So when you are taking a vaccine vial from a ILR and you are noticing that vaccine is frozen, what you will use? What you will do? So the options are continue using the vial as usual, discard the vial immediately, or thaw the vial at room temperature and use it. Consult the supervisor before making a decision. What you will do first? What is the immediate action you will do? You can answer it in your chat box. So the first thing we have to do is discard the vial immediately. We should not store it again in the ILR. And we should not wait for our seniors to get decision. Okay, we have to discard the vial immediately. So thank you for the answers. The next one is about the immunization program in India. So the first immunization program was started in India in the year 1975. The name of expanded program of immunizations. Just go through this year. You have to boycott this year only. So you have to just remember this. And 1985 universal immunization program. So this universal immunization program is mainly for the reduction of mortality and morbidity for the 6 vaccine preventable diseases like diphtheria, tetanus, pertussis, tuberculosis, etc. Then indigenous vaccine production capacity is enhanced and cold chain was established in this way. And it is like universal immunization program is a phased, it was implemented in a phased manner. Then 1986 technology mission on immunization under the 20-point program. Then covering the infant. Then 1992 child survival and safe motherhood included both UAP and safe motherhood. Then RCH1 the year 1997, and this in 2005 National Rural Health Mission. This National Rural Health Mission is mainly focusing on the 100% coverage of immunization of both the pregnant and children under the age of 5. Then in the year 2015 is the year of intensification of routine immunization. And in 2014, no wild polio virus cases was reported from the country. So they didn't report any cases of polio, and this WHO was certified that our country is free from polio. So the last polio case was detected in the year 2011, 13th January, and WHO declared that it was eradicated in the year March 2014. So our last polio case, and this is also one of the success of immunization program of India. So the last case was reported in the year 2011, 13th of January, and WHO declared that polio was eradicated in our country in the year March 2014. So this is the next advancement in our immunization program, that is Mission Indradhanush. So this Mission Indradhanush was started in the year 25th December 2014. We have to remember this year and date. So Mission Indradhanush was started in the year 25th December 2014. So this is also an expanded program of immunization that will cover all children across the India. So those children who are either unvaccinated or partially vaccinated, they are particularly focusing these children in Indradhanush, Mission Indradhanush. So whoever is either unvaccinated or partially vaccinated, they are focusing only these children. So it will provide free vaccines against 12 life-threatening diseases under the universal immunization program, what we have described here. Like same thing what we have in our immunization schedule. And this rotavirus, rubella, and Japanese encephalitis are given only in the endemic state and district. Then intensified mission Indradhanush. So intensified means what will tell, like in Tamil is Tivira Padatapatta, like what we have in pulse polio immunization. Same like that. So here we are to reach the each and every children under 2 years of age, and also the pregnant women who have left uncovered. So in this year, they have the campaign is intensified mission Indradhanush in 5-0 campaign. So they are planning to conduct in the month of August, September, and October. So whoever is partially vaccinated or unvaccinated, they will go through this in these dates, and they will be getting or focusing on this vaccination. Like, so these are the date: August 7 to 12, that is almost over. Then September coming month 11 to 16, and the other one is October 9 to 14. So these are the campaign that this government of India is planning to. So the next one is the immunization schedule. So immunization schedule, this is that I have taken from Wikispedia, that is the recent one. You can go through this. For pregnant women, what vaccine they will use? Early pregnancy, and after 4 weeks, the second dose of DT. So government of India have replaced the TT to TD. In the year 2019, they have replaced it TT to TD because tetanus almost they have reduced, but many cases of diphtheria have been reported in the year 2017 and 18. So they have replaced this with TD. Then the dose is 0.5 ml and intramuscular, and it should be administered in the upper arm. Then BCG, as I said, should be administered immediately after birth or till 1 year of birth. So the maximum age we can administer it. So this immunization schedule will be not useful for your, not only it is useful for your exam purpose, but also in your day-to-day life also you will be asking, because many parents, they will come with this doubt, and they will be like in case of preterm babies, no, they will not administer this BCG vaccine, and this the parents will be very much afraid that whether to give vaccine BCG or not. So they will come to you and they will ask whether I can give this vaccine. So you can tell like BCG can be administered at birth till 1 year of life they can administer. So that will be administered through intradermal route, and you can see the dose. And hepatitis also, the maximum age, like maximum time is at birth within 24 hours. So hepatitis is the one which has to be administered within 24 hours. Then oral polio vaccine can be administered up to 15 days also. Then OPV. So just go through this. I have shared this. Just go through this vaccine. So you have to see the maximum age also. So maximum age we can give. So vitamin A can be, if you are missing the vitamin A dose at 9 months, we can give at 5 years of age also. MR also, if you are missing at 9 months to 12 months, we can give up to 5 years of age. So this other thing that was introduced newly is the rotavirus vaccine and pneumococcal vaccine. So rotavirus vaccine was given at the age of 6 weeks, 10 weeks and 14 weeks, and it can be given up to 1 year of age. Mainly this rotavirus is for focusing on the diarrheal disease. So in order to prevent the diarrheal disease, they are giving rotavirus because children under the age of 5 years are the mortality is high due to diarrheal disease. And then pneumococcal vaccine also in order to prevent pneumonia. So up to 1 year of age they can give, and this pneumococcal vaccine also can be administered after 1 year of age also in case of immunocompromised patients like nephrotic syndrome and all. Like they are in some hospitals they are practicing to give this pneumococcal vaccine also. Then other thing which was newly added is inactivated polio vaccine. So this is in an injectable form, be given in intradermal in the right upper arm. So just go through this. Then Japanese encephalitis, it is in the immunization schedule, but this is given only in the endemic area, not in all state and not in all district. It is given only in the endemic area. So 9 to 12 months, that can be given up to 15 years of age. So these are the main things you have to. Then for children and adult, booster dose, then MR. Previously it was MMR, now it was changed to MR. So let's go through this. So then IPV, so when it was started in the year November 2015, then this RVV, rotavirus vaccine in the year 2019-20, MR in 2017, PCV May 2017, DT in the year 2019. So this DT, they are planning to change in the year 1998 itself. It was initiated by WHO, but only in the year 2018 they have focused. The WHO was telling to implement it compulsory, but only few countries have implemented. But in India, it was implemented in the year 2019. Then these are some of the adverse effect of immunization. So this vaccine related reaction, vaccine quality defect, then immunization error, immunization anxiety related and coincidental thing. So this vaccine product related may be due to precipitated vaccine, then without checking proper VVM, if they are using and if they're getting adverse reaction. Then vaccine quality, that is also like precipitated vaccine from the manufacturing site itself. Then immunization error, inappropriate vaccine like mishandling, misprescription or administration. Then immunization related to the anxiety of vaccine and coincidental. So these are some of the adverse effect following vaccination. Like in case of BCG, mainly lymphadenitis will happen, hepatitis, anaphylaxis reaction, measles, like febrile seizure or thrombocytopenia. Then oral polio vaccine, like paralytic symptoms will occur in some cases, not to all, but the rate is less only. Then DPT. So what we have to use in case of any adverse reaction? We have to send the used or unused vial to CDL Hasoli, then used syringes or unused batches to CDL Kolkata. So whenever you are seeing any adverse reaction, this has to be noted immediately to the health department, the nearby the regional level, and from that regional level, they will be sending the sample of the used vaccine diluent, syringes, needles, everything they will collect and they will send. And in case of Japanese encephalitis vaccine, if there is any issues, they will send to the National Institute of Virus in Pune. Then in case of like autopsy, that should be sent to the accredited state forensic lab. So these are the. So if any questions, you can ask in chat box. Thank you. Thank you for your patient listening and cooperation. Thank you and all the best for you all. Thank you so much.
Participants, please wait. Next session will be started.
Hello.
Yes, ma'am, your
Hello.
voice is.
Thiru sir, can you
can-
hear me?
Yes, ma'am, your voice is audible. Can you share your screen?
1 minute, sir.
Recording in progress.
I think it's going. Is my screen visible, sir?
Yes, ma'am.
திரு சார் என்னோட இன்னொரு அக்கௌண்ட் மியூட்ல போட முடியுமா? எனக்கு எக்கோ வருது.
Yes, ma'am. You can share your screen, ma'am.
நோ ப்ராப்ளம் சார், விட்டுருங்க. ஸ்பீக்கர் ஆஃப் பண்ணிட்டேன். ஹலோ.
Yes, ma'am, your voice is audible.
ஓகே, தேங்க்யூ சார்.
Yes, ma'am.
Okay, good evening, everyone. Myself, Tamil Ilakya. I am working as nursing officer in AIMS Mangalagiri. I've completed my master degrees in psychiatric nursing from MMC. In today's session, we are going to see about general facts about psychopharmacology and in some depth, detail about the antipsychotics. So first, what is psychopharmacology? Psychopharmacology is nothing but the name itself. It says if you split the name, psych and pharmacology. Pharma means medicines, ecology is study. So psychopharmacology is nothing but study of drugs that used to treat the psychiatric disorders, or the study of drugs that used to treat the disorders associated with brain or mind or any other high cognitive functions. It is called the psychopharmacology. Hello, is my voice audible?
Yes, audible, ma'am.
Okay. Psychopharmacology is the study of drugs that used to treat the psychiatric disorder is called as the psychopharmacology. And the medications that affect the psychic function, behavior, or experience are called as the psychotropic medications. So all the higher mental functions like your thinking, behavior, emotions, perception, everything are called as the higher mental functions. And the drugs which cure the higher mental function disorders is called as the psychotropic medications. So before moving on to the drug and its management and its mechanism of action, just we have a overlook on these terminologies related to the psychopharmacology. First one is your efficacy. So efficacy refers to the maximum therapeutic effect that a drug can achieve. For example, if the efficacy means if you are taking ranitidine, for example, the dosage of the ranitidine will be 150 mg. So the drug will be using all its 150 mg to achieve a therapeutic effect on the body is called as the efficacy. This is called as the maximal therapeutic effect that the drug can achieve is called as your efficacy. Whereas the potency is the amount of drug needed to achieve that maximum effect. So based upon your weight of the patient, the doctors will be, the physicians or the doctors will be prescribing the drug. For example, you will be having 5 ml per kg per day. Like that, the doctors will be prescribing. So potency is the amount of the drug that is required to produce the maximum effect is called as the potency. So half-life is nothing but the half of the medicine will be removed from your bloodstream. That is called as your half-life. So half-life is the time taken by the drug to be removed from the bloodstream is called as the half-life. The half-life for the antipsychotics will be 10 to 24 hours. For antidepressants, it will be more than 24 hours. So each drug has a varied half-life. So half-life is nothing but it is the time taken for half of the drug to be removed from the bloodstream is called as the half-life. Next, we have two words. One is agonist and one is the antagonist. Agonist, that means a drug that binds with the receptors or it activates the receptor. So agonist means it will be binding together. It will be together. That is called as the agonist. So it is a drug that it binds and activates a receptor. Whereas the antagonist is the exact opposite of the agonist. So antagon, that means it is opposite. So antagonist means it will not activate the receptor, it blocks the receptor. In action, it will block the receptor. So agonist will be activating the receptor, whereas the antagonist will be blocking the receptor. So this is the difference between the agonist and agonist. So next is your neurotransmitters. So neurotransmitters are nothing but it is a chemical substances. So this will be stored in the neurons. So neurotransmitters are nothing but your chemical substances that will be stored in the axon terminal of the neurons. So this will be responsible for the transmission of impulses from one neuron to the other neuron. So neurotransmitters, it will be a chemical substance that will be helping the neurons to transfer impulses from the one part of the brain to the other part of the brain. And it will be stored in the axon terminals of the terminals of your neurons. It is called as the neurotransmitters. So the examples of the neurotransmitters are your dopamine, your serotonin, acetylcholine. These are the examples of the neurotransmitters. So next comes your, so this is the general synapse. So this is the general synapse. This is the axon terminal of the neuron. So this axon terminal is the place where your neurotransmitters will be stored in the vesicles. Vesicles, these are the vesicles. Your neurotransmitters will be stored in this vesicles. So when the impulses, so when the impulses from the brain cells from one neuron to the another neuron transfers through this axon terminal only. So this is the way from where the electrical impulses will be passing from one neuron to the another neuron. So these are the neurotransmitters where it is stored in the axon terminal of the one neuron. So this area is called, this complete area is called as the presynapse, and the space between these two neurons is called as the, and the space between two neurons, this space is called as the synaptic cleft, and this end is called as the postsynaptic membrane. So your neurons has two synapses. One is your presynapse, this area, and one next is your postsynapse, this area. And the space between your presynapse and the postsynapse is called as the synaptic cleft. So this is a general anatomy of your neurons. So all your neurotransmitters will be stored in vesicles in the axon terminal of your presynaptic membrane. Is it is clear? Do you have any doubt up to this? So the next comes the definition of the psychotropic drugs. As we said earlier, psychotropic means the drugs that deals with the disorders in the brain. So the higher mental functions includes your behavior, experience, emotions, and other psychological functions like your cognition, perception, etc. So the psychotropic drug is any drug that has the primary effects on the behavior, experience, or other psychological functions is called as your psychotropic drugs. Otherwise, it is also called as a chemical. A drug is nothing but a chemical substance. So, a psychotropic drug is also defined as a chemical that affects the brain and nervous system, that alters the feeling and emotions is called as the psychotropic drugs. So, on the whole, psychotropic drugs is nothing but it is any drug or a chemical substance that alters the behavior, experience, emotions, and other psychological factors is called as the psychotropic drugs. So next we'll go to the classification of the psychotropic drugs. It is a major classification. Psychotropic drugs is a broad phenomenon in which many classification of the psychiatric drugs come. The first is your antipsychotics. Second, it is your antidepressants. Antidepressant drugs are used to treat the depression and other depressive episode disorders. Mood stabilizing drugs that is used for the mania, depression, as well as the bipolar affective disorders. Anxiolytics and hypnosedatives that is used to treat the anxiety disorders. Anti-epileptic, anti-Parkinsonian drugs, and miscellaneous drugs such as stimulants, drugs used in eating disorders, drugs used in de-addiction, drugs used in child psychiatry. So the classification of the psychotropic medications are antipsychotics that is used to treat the psychotic and schizophrenic related disorders. Second one is your antidepressants that is used to treat the depression as well as the other major depressive episodes. Mood stabilizing agents that will be dealing with the mania, depression, as well as the bipolar affective disorders. And next is your anxiolytics and hypnosedatives, which is your benzodiazepines drug which will be dealing with your anxiety disorders. And next is your anti-epileptic, anti-Parkinsonian drugs. The miscellaneous drugs includes drugs that is used in treating the eating disorders, de-addictions, and drugs used in the psychiatric disorders of the children. So these are the classifications of the psychotropic medications. And in this session, we are going to see in detail about the antipsychotics. So the word antipsychotics itself, you will be knowing anti means against, psychotics means your psychosis disorder. So the drugs used against the psychosis disorder is called as the antipsychotics. The symptoms of antipsychotics are, in example, the patient will be having delusion, hallucination, affective thinking, anhedonia, alogia, apathy. So these are the general psychotic symptoms. So the drugs that used to treat the psychotic symptoms are called as the antipsychotics. So next, the other name for the antipsychotics are also called as the neuroleptics because they'll be producing some neurological side effects such as extrapyramidal symptoms. So it is also called as the neuroleptics, also called as the major tranquilizers and D2 receptor blockers. So the major action of the antipsychotic medications will be on the dopamine receptors. So it is also called as the D2 receptor blockers and anti-schizophrenic drugs. So the other names for the antipsychotics are the neuroleptics, major tranquilizers, D2 receptor blockers, and anti-schizophrenic drugs, because the schizophrenia is the major psychotic disorders in this classification. So it treats the symptoms of schizophrenia. So it is also called as the anti-schizophrenic drugs. Next, the antipsychotic medications. One more important thing is this antipsychotic medicines does not cure the complete illness. The recovery of the complete illness is not based on the antipsychotic medicines. Added on with other psychosocial therapies, the patient will have the recovery based upon the prognosis. So antipsychotic medications, it won't cure the illness, but it will subside the symptoms, or it makes the symptoms milder, so that the patients can live their day-to-day activities without any support. So antipsychotic medications does not cure the illness. It just take away the symptoms, or it milder the level of the symptoms, so that the patient will be returning back to your normal state of living. So this is one important thing. And the first antipsychotic medication was introduced in the year 1952. The first antipsychotic medication introduced is chlorpromazine. So in the 1952 only, they introduced the medication called as the chlorpromazine, and it has been a trendsetter in the psychotic treatment of the psychiatric illnesses. It is believed that these medications alleviate all the psychotic symptoms in the client. So antipsychotics generally alleviate all the psychotic symptoms, and the first drug was introduced in the year 1952, and it is chlorpromazine. The take-home message in this slide is the first drug is introduced in the year 1952, and it is chlorpromazine. Next, we'll see the general indications for the antipsychotics. First is your organic psychiatric disorder. As we said, it is the antipsychotics. The major will be delirium, dementia, delirium tremens, drug-induced psychosis, and other organic mental disorders such as organic hallucinosis and organic delusional disorders. So, hallucination delusions are the part of the acute psychosis. So, the organic psychiatric disorders such as delirium, dementia, delirium tremens, drug-induced psychosis, and other organic mental disorders such as organic hallucinosis and organic delusional disorders are the one of the indications for the antipsychotics. Then is the functional disorders. The functional disorders comes here. As the name says, it is anti-schizophrenic drugs. So it deals with the diseases such as schizophrenia, schizoaffective disorders, and paranoid disorders. And it also plays a role in the mood disorders. As we said, mood disorder, we have mania, depression, and the bipolar affective disorders. So mania and the major depression with the psychotic symptoms will be treated with the antipsychotics. So the organic psychiatric disorders are delirium, dementia, delirium tremens, drug-induced psychosis, and other organic mental disorders includes organic hallucinosis and organic delusional disorders. The functional disorders are, it deals with the schizophrenia-related diseases, that is schizophrenia, schizoaffective disorders, and paranoid disorders. The next comes your mood disorders. If the patient is having major depression with psychotic symptoms, then antipsychotics will be given for the treatment, and the patient with the mania, antipsychotics is also a drug of choice. The other indications for the antipsychotics are the childhood disorders like ADHD, autism, neurosis, and conduct disorders. For these conditions also, antipsychotics are prescribed. The neurotic disorders such as eating disorders, anorexia nervosa, obsessive compulsive disorder, and the disabling anxiety, that is anxiety disorders. So these are the conditions where the antipsychotics will also be prescribed. So it is also used in the medical disorders like Huntington's disease, hiccups, continuous hiccups, nausea and vomiting, tic disorders, eclampsia, heat stroke, severe pain in malignancy, and tetanus. These are the conditions where the antipsychotics will be prescribed. So on the general, the antipsychotics indications are, it will be used for drug-induced psychosis, schizophrenia, schizoaffective disorder, mania, major depression, as well as the dementia and delirium tremens. The other disorders includes childhood disorders in which ADHD, neurosis, autism, and conduct disorders will be included. And the neurotic disorders such as eating disorders, OCD, and anxiety disorders also, the antipsychotics are prescribed. So next we'll see the classifications of the antipsychotics. So in general, we have the classification of antipsychotics as typical antipsychotics or conventional antipsychotics and the atypical antipsychotics. So the typical antipsychotics are the first generation drugs. The first generation drugs has two types. It has high potency and the low potency. The first generation antipsychotics are chlorpromazine, prochlorperazine, and thioridazine. So the important drugs to be remembered is chlorpromazine. It is the first generation antipsychotics. It was introduced in the year 1952 and it is a low potent antipsychotic drugs. Next comes your first generation high potency antipsychotics, that is fluphenazine, haloperidol, pimozidine and thiothiazine. So the important drugs to be remembered is fluphenazine and the haloperidol. Then next comes your second generation antipsychotics, which is also called as the atypical. The first generation antipsychotics, it is called as the typical or conventional antipsychotics. It is chlorpromazine, fluphenazine, and haloperidol. The second generation is your atypical antipsychotics that includes epiprazole, clozapine, olanzapine, quetiapine, paploridone, risperidone. These are the drugs that were being used in the second generation antipsychotics. So the mnemonics to be remembered is sorry. So the So atypical antipsychotics, the mnemonics to be remembered is rich queens are clumsy old zillionaires. So the rich queens stands for risperidone, queen stands for quetiapine, apiprazole, and C is clozapine, O olanzapine, and Z is ziprasidone. So the atypical antipsychotics can be remembered with the mnemonics. Rich queens are clumsy old zillionaires. So rich R is for your risperidone, Q is for your quetiapine, R A is for your apiprazole. Apiprazole is the newly discovered drug, and C is your clozapine, O is your olanzapine, and Z is your ziprasidone. So these are the important atypical antipsychotics that we should remember. And the mnemonics to remember this are rich queens are clumsy and old zillionaires. So R is for your risperidone, quetiapine, apiprazole, clozapine, olanzapine, and ziprasidone. This is your atypical antipsychotics. Then comes your typical antipsychotics. It is H plus zymes, haloperidol, olanzapine, trifluperazine, chlorpromazine, thioridazine. So these are the typical antipsychotics. Haloperidol is very important. And in that, all the drugs ending with INES will be coming in the typical antipsychotics. So next we'll see the pharmacokinetics. So pharmacokinetics is nothing but how the drug will be intake, how it will be absorbed, how it will be excreted and metabolized is the general we'll talk in the pharmacokinetics. Usually we will be taking all the antipsychotic drugs orally. It will be absorbed in the gastrointestinal tract. Then the antipsychotic medications are highly bound to the plasma as well as to the tissue proteins. So the brain concentration is higher than the plasma concentration. So the drug level is higher in the brain concentration than in the blood concentration. So as it is absorbed in the gastrointestinal tract, it usually all the drugs will be metabolized in the liver and it will be excreted in the kidneys. So the antipsychotics will be variably absorbed in the gastrointestinal tract. It will be metabolized by the liver and it will be excreted through the kidneys. And the blood concentration level is lower in the antipsychotics because the brain concentration levels are higher in the antipsychotics because it is highly bound to the plasma proteins, plasma or else this tissue proteins. The half-life of this drug is 10 to 24 hours. So the time taken by the antipsychotics, half of the time to exit from the bloodstream is only 10 to 24 hours. So most of the, and the other important thing in this antipsychotics is all these antipsychotics will have a therapeutic window. Therapeutic window means they will be measuring the drug level. They will be taking the blood from the patient and they will be measuring the drug level in the blood. So if the blood level is below the window, there will be a window level. It has a higher value and it has a lower value. So for example, the therapeutic level for the Hello?
Yes, ma'am.
Okay, thank you. The therapeutic level for the antipsychotics are in general, it is about 0.2 to 1 microgram per ml. So it has one higher value, it has one lower value. The therapeutic window is 0.6 to 0.2 to 1 microgram per ml. So if the drug level is below this window, the drug is ineffective. If the drug level is below 0.2 microgram per ml, the drug is considered to be ineffective. If the drug level is more than 1 microgram per ml, also the drug is resulting in the toxicity and it is again ineffective. So that there is a therapeutic window and the patient will be monitored for this therapeutic window. Based upon this, the dosage will be altered. So this is one of the important measures that we have to remember in the antipsychotics. And the therapeutic level for the antipsychotics is in general 0.2 to 1 microgram per ml. If it is more than 1 microgram per ml, then it results in the toxicity. Please do remember this. So next we'll see the mechanism of action. So how it works, where it binds, how it will be reducing the symptoms of the psychotics, we'll be seeing in the mechanism of action. The first one is, first we'll explain the figure and then I will be showing you the slide. So the antipsychotic drugs, as we already said, it is a D2 receptor blocker. It acts on the dopamine receptors in the mesolimbic and the mesofrontal area. So this is the drug usually acts on the mesolimbic and the meso pathway of the brain. So these are the important systems. So where the dopamine receptors will be present in the high number. So the drug will be acting on the mesolimbic and the mesofrontal pathway. So here this is the presynaptic area, this is the postsynaptic area, and this gap is your synaptic cluster. And this gap is your synaptic cluster. So when your neuroelectrical impulse is transferred, the dopamine receptors which is stored in the vesicles here, it will be released into the synaptic cluster. So in schizophrenia, what it happens means there will be excess of dopamine levels in the synaptic cluster. So these are the excess of dopamine levels in the synaptic cluster are responsible for the symptoms of the schizophrenia. Here what happens means this is the receptors where these are the dopamine sensitive receptors. These dopamines will be going and acting upon this, and then it will be the electrical impulses will be transferred to the next neuron. Here what happens means the drug is there. No, these are the drugs. These drugs will be going and binding into the dopamine receptors, and this already opened dopamines in the synaptic cleft. It will be taken back to the presynaptic phase, and or it will be metabolized by the cholinesterase or monoamine oxidase inhibitors. So in neurotransmitters, there is a two enzyme called as the cholinesterase and monoamine oxidase. So these two neurotransmitters, what they will do means these two will be degrading or break down the circulating catecholamines in the synaptic area. So these will be degraded and the dopamine levels will be altered in the schizophrenic patients, and thus the symptoms of the schizophrenia will be reduced. So the 1 minute. So the antipsychotic receptors usually block the D2 receptors in the mesolimbic, in the mesofrontal portion of the brain. So sedation is caused by the alpha-adrenergic blockade. So as the dopamine receptors are blocked on the basal ganglia, the midbrain of the region is blocked. The dopamine receptors are mostly found in the basal ganglial regions. So it is the midbrain of the mid part of the brainstem. So as the receptors in the mid part of the brainstem is blocked, it is responsible for the extrapyramidal symptoms. So because of this reason only, the patient is getting the extrapyramidal symptoms. As we already discussed that there is two types of antipsychotics. One is typical or conventional, and second one is your atypical antipsychotics. In this, so the drugs such as conventional or typical antipsychotics has the higher incidence for the extrapyramidal symptoms. So your typical antipsychotics includes your chlorpromazine, your haloperidol, triflupenazine, triflupromazine. These are the drugs that are responsible for the greater incidence of the extrapyramidal symptoms. So to reduce the incidence of the extrapyramidal symptoms, The typical antipsychotics, atypical antipsychotics are introduced, such as your risperidone, clozapine, olanzapine, quetiapine, risperidone, piprazole. These are the drugs that are introduced for the treatment of the patients with the schizophrenia to prevent the extrapyramidal symptoms. So first we'll see what is the extrapyramidal symptoms. So as we said, the blockade of dopamine receptors in the midpoint of the brain stem, extrapyramidal symptoms are occurring. So the extrapyramidal symptoms has 5 types. First one is your neuroleptic induced Parkinsonism disease. Second one is your acute dystonia. Third one is your akathisia. Fourth one is tardive dyskinesia. And fifth one is your neuroleptic induced malignant syndrome. I repeat again. First is your neuroleptic induced Parkinsonism. Second one is your acute dystonia. Third one is your akathisia. Fourth one is tardive dyskinesia. And fifth one is your neuroleptic induced malignant syndrome. So first one is your neuroleptic induced Parkinsonism. As the name says Parkinsonism, the patient will be having the symptoms of the Parkinsonism, such as bradykinesia, rigidity, tremors, stooped posture, drooling of saliva, ataxia. Like this, the patient will be having the symptoms of the Parkinsonism. The main symptoms will be include rigidity, tremors, stooped posture, bradykinesia, and drooling of the saliva. The same as that of the feature of Parkinsonism will be present in the patients. So this disorder can be treated with the anticholinergic agents. The next comes your acute dystonia. Acute dystonia, that means there is the difficulty or there is an abnormality in the muscle tone. Dystonia means there is an abnormality in the muscle tone. Here, the patient will be having a slow, sustained muscular system that will be leading into the involuntary movements. So first, the patient will be developing the slow, sustained muscular spasm, then it will be leading into an involuntary movements. The patient will also have an oculogyric crisis. Oculogyric crisis means nothing but there will be the upward lateral movement of your eyes or eyeball. So the patient will be having the oculogyric crisis, and the patient, same as that of meningitis, the patient will be assuming the opisthotonous position. So this is dystonia. So dystonia means the patient will be having slow sustained muscular spasm that leads into an involuntary movement. Second one is your opisthotonous position, and third one is your oculogyric crisis. So this is acute dystonia. Here the patient is having oculogyric crisis. That is the lateral upward movement of the eye is called as the oculogyric crisis. Lingual protrusion is nothing but the tongue is out, and that is your bleoparapasm. That next is your so bleoparapasm is nothing but it is twitching of your eyelids. That is called as a bleoparapasm. And next last comes your torticollis. So torticollis is nothing but the neck muscles will be twisted. So this is torticollis. This is the twitching of your neck muscles. Oculogyric crisis is lateral upward movement of the eye. Lingual protrusion is nothing but the tongue will be kept out. And last is your bleoparapasm. Bleoparapasm is nothing but twitching of the eyelids. Here the patient is having the symptoms of the Parkinsonism such as rigidity, tremors. The patient's hands are shivering, rigidity, tremors, and bradykinesia. Along with that, the patient will be having oculogyric crisis, and the patient also assumes the opisthotonous position. This is your acute dystonia. And the next comes here akathisia. So akathisia is also a muscular discomfort. The patient will be having the subjective feeling. The patient feels that there is a muscular discomfort because he can't open the eyes and he can't fetch the fingers properly. The patient will feel that he is having some muscular discomfort. So because of that, the patient will be feeling agitated, restless, and feels dysphoric. Dysphoric is nothing but the patient will be having difficulties in changed abnormal mood behavior. That is dysphoric. So akathisia can be treated with propranolol, benzodiazepines, and clonidine. The next comes your tardive dyskinesia. So it is very important. Tardive dyskinesia is the patient will be assuming the dancing-like position. That is choreo-orthoid movements of the muscles of your upper body, limb, and the lower body. So this is the tardive dyskinesia. You can see that in the images. So it is a delayed adverse effect of antipsychotic. It includes irregular choreo-orthoid movements. That is dancing-like movements. Choreo-orthoid movements of the muscles of your head, trunk, and the limb. That is your upper body, trunk, as well as the lower body will be affected. And other important feature is the patient will be having difficulties in chewing, sucking, grimacing, and other perioral movements. The last comes your neuroleptic malignant syndrome. So the neuroleptic malignant syndrome, it has three parts. The patient will be, usually the onset is rapid. It occurs usually within 24 to 72 hours. The clinical pictures will be occurring rapid in onset. Usually you will be identifying the clinical pictures from 24 to 72 hours. But the entire neuroleptic malignant syndrome takes 10 days for it to diagnose. So first one is it has three important characteristics. First one is your severe motor, mental and autonomic disturbances the patient will be having. The word motor symptoms says that there is an abnormality in the muscle and muscle related substances. So prominent motor symptom is the patient will be having generalized muscular hypotonicity. There will be the stiffness of the muscles in the throat and the chest. So as the muscles in the throat and the chest have become stiffness, the patient will be having difficulty in breathing as well as difficulty in swallowing. So the stiffnesses of the muscle in the throat and the chest may cause dysphagia as well as dyspnea. Next comes your mental symptoms. The mental symptoms is the patient will be having akinetic mutism. If the patient won't speak anything, the patient wants to speak also, the patient can't able to speak. That is called as your akinetic mutism, stupor or impaired consciousness. The patient will be having a stupor state or impaired consciousness. And last comes your autonomic disturbances. So autonomic disturbances is the patient will be having hyperpyrexia. That is the patient will having increased body temperature or increased fever. And the patient will also have unstable blood pressure, tachycardia, excessive sweating, salivation, and urinary incontinence. So the first is your motor symptoms. In the motor symptoms, the patient will be having hypertonicity, muscular hypertonicity. Next, the patient will be having stiffnesses in the muscles of the chest and the throat, so that it ultimately ends up in the dyspnea and the dysphagia. The next comes your mental symptoms. The mental symptoms, it includes the patient will be having akinetic mutism. The patient won't speak anything. Next, the patient will be in a stupor state. The last comes your autonomic disturbances. The first symptom of your autonomic disturbances is your hyperpyrexia, increased fever, and then the patient will also have associated symptoms like unstable blood pressure, tachycardia, excessive sweating, salivation, constipation, and urinary incontinence. So these are the general symptoms about the neuroleptic malignant syndrome. So another one take-home messages is the extrapyramidal symptoms has 4 rules. Rules of force we say. The first 4 hours, acute dystonic reactions will be coming. So the dystonia will be coming in the first 4 hours. And then the next will be taking 4 days for the Parkinsonism diseases to come. And the 4 weeks will be taking for the akathisia. And 4 months will be taken for the tardive dyskinesia to come. So the extrapyramidal symptoms as the rule of force. Within 4 days, acute dystonia will be coming. Within 4 hours. Next, the patient will be developing Parkinsonism within 4 days. Akathisia will be occurring within 4 weeks, and it will take 4 months for the tardive dyskinesia to occur. So, on the whole, the extrapyramidal symptoms has a greater incidence for the conventional antipsychotics, whereas the atypical antipsychotics have lower incidence for the extrapyramidal symptoms. And the main reason for the extrapyramidal symptom is nothing but it is the blockade of D2 receptors in the mid part of the brainstem or basal ganglia. So because of this blockage only, the patient is developing the extrapyramidal symptoms. The 5 symptoms that are included in the extrapyramidal symptoms are, first one is, and the first, okay, I still will write. This is 4 days. This is 4 days. This is 4 hours. This takes 4 weeks. This takes 4 months. These are the 4 rules, rule of force for the extrapyramidal symptoms. So the 5 symptoms of extrapyramidal symptoms is here. First one is neuroleptic induced Parkinsonism, acute dystonia, akathisia, tardive dyskinesia, and last one is your malignancy syndrome. So neuroleptic induced malignancy syndrome. So the second, in the patients with this neuroleptic malignant syndrome, the creatine phosphokinase (CPK) level will be elevated in the blood, and the secondary complications of this neuroleptic malignancy syndromes includes pneumonia, thromboembolism, renal failure, as well as the cardiovascular dysarrhythmias. So cardiac dysarrhythmias are the secondary complications of the neuroleptic malignant syndrome, and acute dystonia will be lasting for 4 hours. The Parkinsonism will be taking for 4 days, and 4 weeks for the akathisia and 4 months for the tardive dyskinesia to occur. So these are in general about the extrapyramidal symptoms. Next, we'll see the autonomic side effects. So the general mnemonics to remember the antipsychotics is eye shade. Sorry. So this we'll see at the end. So the next we'll see the autonomic side effects. The autonomic side effects includes in general symptoms, that is your dry mouth, constipation, cycloplegia. Cycloplegia is nothing but the paralysis of the ciliary muscles of the eye. That is called as a cycloplegia. Mydriasis is nothing but the dilatation of the pupils, urinary retention, orthostatic hypotension. The patient will be having one blood pressure in the sitting position, and in the lying position, the patient will be having one blood pressure. That is your orthostatic. There is a variation in the blood pressure in the sitting position, and the lying position is called as the orthostatic hypotension, impotence, impaired ejaculation, seizures, and sedation. So these are the autonomic side effects. Other side effects that are included are agranulocytosis. Agranulocytosis means there will be decrease to your WBC count. It is especially for the drug clozapine. Next is siluria or increased salivation. This is also especially for the clozapine. Weight gain, jaundice, and dermatological side effects such as contact dermatitis and photosensitive reactions. As we said, there will be impotence or impaired ejaculation for the male. For the female, there will be abnormal menstrual cycles. There will be abnormalities in the menstrual cycle, and the patient may end up in the infertility. For both the males and the females, the breast may become enlarged, and there will be fluid leaking out from the nipples. So it is common in both the males and the females. So this is due to the increase in the prolactin levels because of the drug risperidone and the papilloridone. So with this, all these autonomic side effects in general are due to the atypical antipsychotics such as clozapine, risperidone, and papilloridone. The clozapine as an causes agranulocytosis and increased salivation. The impotence and the impaired ejaculation in the males, and the infertility or abnormal menstrual cycles in the females, and the enlargement of the breast in both the females and males is due to the risperidone and papilloridone drugs. So these are the autonomic side effects. In general, the mnemonics to remember the antipsychotic drugs are eye shade. I is for your impotence, S for is your sedation and seizures, H is for your orthostatic hypotension, A for is your akathisia, inability to sit. Dermatological side effects includes photosensitivity reactions and contact dermatitis, and E is for your extrapyramidal symptoms. That includes acute dystonia, tardive dyskinesia, akathisia, everything. So this is the general mnemonics to remember the antipsychotics, that is your eye shade. So now we have seen about what is antipsychotics, what are the classifications of antipsychotics, what are the drugs that comes in the antipsychotics, how it is metabolized, how it is excreted, what is its mechanism of action, what are the side effects, everything in detail. Now we'll see what is the role of nurses in this antipsychotics management. So first, as we told, the patient will be having dry mouth and constipation, which is the autonomic side effects. For that, you have to instruct the patients to take sips of water frequently to relieve from the dryness of the mouth. So the frequent mouth washes, using of chewing gums. So we can ask the patient to take sugarless chewing gums. So it will be helping to decrease the dryness of the mouth. Next, the patient is having constipation. So we'll be advising the patient to take high fiber diet, and we'll be asking the patient to increase the intake of the fluids. Will be asking the patient to drink 2 to 4 liters of fluid intake. If the patient is having ineffective of taking high fiber diet and increased fluid intake, the patient is ending up in the constipation, then we'll be asking the patients to take the laxatives as prescribed by the physicians. So this will be helping the patient to reduce the constipation. Next, we told the patient will be having orthostatic hypotension. So orthostatic hypotension means we should advise the patient to get up from the bed, and then they have to put their feet down. After 1 minute, then ask the patient to move from the bed. So the patient should not wake up and immediately move out of the bed. The patient will be resulting in hypotension. So you have to advise the patient to get up from the bed very slowly, to sit on the edge of the bed, dangle their legs down, and after 1 minute, ask the patient to move out of the bed. So this will prevent the orthostatic hypotension. So another important measure is we have to check all the vital parameters, especially before and after administration of the drugs. This also prevents the fall associated with the orthostatic hypotension. The next comes the observe the patient regularly for the abnormal movements. If the patient is having any other abnormal movements such as rigidity, tremors, bradykinesia, tardive dyskinesia, so advise the observe the patient for the abnormal movements regularly, so that the extrapyramidal symptoms will be identified earlier. Another side effect is your seizure. So take all the seizure prevention precautions. If the patient has seizure, means the drug of choice is phenytoin in these cases. The patient should be the first for the first 10 days, you have to advise the patient to be very cautious. So any work that is requiring the full concentration should be avoided for the first 10 days of antipsychotics. Because, for example, if the patient are driving a car or handling a machinery, in the first 10 days of the antipsychotics, there is a chances for the accidents. So giving the entire dose at the bedtime usually eliminates any problem from the sedation, because sedation is one of the causes for the antipsychotics. Next, the patient will be having dermatological conditions such as contact dermatitis and the photosensitivity reaction. In such cases, you have to explain the patient to use sunscreen measures. That is, you have to advise the patient to wear full sleeve, take the sunscreen, next cover the areas with the glasses. These are the measures that we can advise the patient to prevent the photosensitive reactions. And then next comes your WBC counts, which, as we discussed earlier, clozapine causes agranulocytosis. So TCDC, your WBC count should be checked in the first few weeks of the treatment. If the patient's WBC count is less than 3000 per cubic millimeter of the blood, the drug has to be stopped immediately. And advise the client to inform any incident of sore throat or infections, because sore throat or any fever episodes will indicate the signs of infection. The infection may occur because of the low WBC counts. So in that, you also educate the client to say about any sore throat or any fever episodes during your drug intake. And the last important thing is you have to teach the client about the drug complaints, what are the side effects of the drugs, etc. in detail, so that they will be coming and get the medical treatment prior before the extreme side effects occurs. So these are the nurse's responsibility occurs with the antipsychotics. So now we'll move on to the question session. So please put your answers in the comment section. So the scenario is a 29-year-old client is being seen for the diagnosis of schizophrenia. The patient has added an atypical antipsychotic medications for disease management, which best describes how this type of medication works. The answer is so the patient is on atypical antipsychotic medications. So the mechanism of action will be on the dopamine receptors. So the answer is A. So by acting on the dopamine receptors, the symptoms of the schizophrenia will be reduced. The second question is, a client is diagnosed with neuroleptic malignant syndrome. Which of the following events has the client likely experienced? So the patient has now neuroleptic malignant syndrome. Which recent event that the client has likely experienced? D is the right answer. So antipsychotic medication, one of the side effects is neuroleptic malignant syndrome. So the recent intake of antipsychotic medications, if there is there means that will be the answer for this question. Next, which of the following medication would be classified as an antipsychotic medications? D. Because secobarbital, alprazolam, these are all the benzodiazepine drugs, that is anti-anxiety medications. Methylphenidate is the miscellaneous drugs that is used in the childhood associated psychiatric disorders. Haloperidol is your typical antipsychotic medications. The next last question is, the nurse is caring for a client with dystonia. What is the priority intervention for this client? So next, now we move on to the next question. The client is caring for the client with dystonia. What is the priority nursing intervention for this client? A is your place the patient on the fall precautions. B, place the patient on the seizure precautions. C, give the client a face mask. Get the client's pain under control. So what will be the priority nursing intervention? The word priority is there in the question. What is the meaning for the word priority? Note that and answer the questions. First is the place the client on the fall precautions. That is the answer. Next is, a client diagnosed with schizophrenia is slow to respond and appears to be listening to unseen others. Which medication should a nurse expect a physician to order to address this type of symptoms? So which drug they will be ordering? Whether they will be ordering the haloperidol, risperidone or chlorpheniramine. So first, before answering this question, we should come to know what are the positive symptoms, what are the negative symptoms of the schizophrenia. So what are the positive symptoms of the schizophrenia in general? So the positive symptoms of the schizophrenia are hallucination, delusion, excitement, hostility, suspiciousness, suicidal tendency. These are the positive symptoms of the schizophrenia. Whereas the negative symptoms includes all your 4 A's: affective thinking, apathy, anhedonia, avulsion, attentional impairment, alogia. These are the negative symptoms of the schizophrenia. So for this question, the answer will be risperidone to address the positive symptoms. So it is very easy to address the positive symptoms of the schizophrenia. So all your atypical medicines will be acting on the positive symptoms of the schizophrenia. So in this, haloperidol is your typical antipsychotic. So it will be addressing the negative symptoms. Clonazepam is not an antipsychotic. It is the benzodiazepine. Clozapine is also atypical antipsychotic, but it is not addressing the negative symptoms. Usually, the atypical antipsychotics will be addressing the positive symptoms, whereas the typical antipsychotics will be addressing the negative symptoms. So, in this condition, risperidone is the answer. So, next, this is the question that has been asked in the NORCET 2021. So, if clozapine therapy is being considered, the nurse should evaluate which laboratory test to establish a baseline for comparison in order to recognize the potentially life-threatening side effects. So this question came in answer 2021. So which antipsychotic medication that clozapine is given, what laboratory investigation you should monitor? It is good. It is white blood cell counts. So WBC's counts will be agranulocytosis is one of the side effects of the clozapine. So the client taking clozapine should be monitored for the WBC levels periodically. So these questions came in NORCET 2021. Now let's see. A client diagnosed with schizophrenia takes an antipsychotic agent daily. Which assessment findings should a nurse immediately report to the client's attending psychiatrist? Respiration of 22 beats per minute, weight gain of 8 pounds, temperature of 104 degrees Celsius, 104 degree Fahrenheit, and excessive salivation. So, which of the clinical assessment found was to report to the clinical psychiatrist immediately? Excessive salivation will not be the answer. Excessive salivation is one of the side effects of the schizophrenic medications. But temperature of 104 degree Fahrenheit should be reported immediately because the neuroleptic malignant syndrome has hyperpyraxia as one of the clinical indicators. So if the patient is having the temperature of 104 degree Fahrenheit, the patient may end up in the neuroleptic malignant syndrome, autonomic disturbances. So if the client has a temperature of 104 degree Fahrenheit, it has to be reported to the psychiatrist immediately. This is the answer. Okay. So this is about the antipsychotics. Is that clear? Do you have any doubts? If you have any doubts, you can ask. Is there any questions to be asked? If you have any questions, you can put in the comment section and we'll be reading it later and will be answered in the forthcoming classes. Thank you. Thank you for your comments. Tirupati sir.
Yes.
And antipsychotics is over, sir. If you have any doubts, you can put the questions in the comment section so that I can read that and I'll be answering to the questions. So one important thing that we have to remember in answering the nursing related questions is your priority care. So CAB, circulation, airway, breathing, in that format only you have to answer. Or ABC, airway, breathing and circulation. So based upon that, you prioritize your nursing intervention and answer the question. And important thing that you have to answer in a question is you have to identify the stem of the question. What is the key point presented in the stem? It is priority or least priority or most priority. With that, the keyword you have to identify in the question, and based upon that, you have to answer your question. Please do remember that while you are answering the questions.
Hello.
Hello.
My voice is audible?
Yes, sir. சொல்லுங்க சார். கேக்குது sir.
It was very wonderful session, ma'am. It's a good
Thank
explanation.
you, sir.
And all the participants, thank you so much for your active participation. And for 2 days class, the demo class is completed by this time. And if you have any queries, you can contact with us. And already I told the beginning of the class itself, for joining procedure, everything I mentioned beginning of the class today. So just to contact us, be with us. Surely you stay with your track, and surely you will get success. And we'll touch you soon. Thank you so much. If you have any queries, you can ask me now. You can unmute yourself. You can ask the queries.
You can also say us the feedback so that we can be incorporating that comments into the future classes. Or you can post your questions or your queries or feedback, comments, everything in the chat box. We'll be reading that. கிளாஸ் ஸ்லோவா எடுங்க. டைம் ரொம்ப கம்மி சார். கண்டென்ட் கவர் பண்றதுக்காக ஃபாஸ்டா போக வேண்டியதா இருக்கு.
We will give recording section, ma'am. We will give recording session also. And we uploaded in our WhatsApp, our YouTube channel also. You can watch the yesterday class in our YouTube channel. We will share the link. And the main class will be taken by very slowly, don't worry. And because as ma'am told the same thing, because the time is consuming and also it's very short period. We can't take this because already the large topic, this topic is very vast, but ma'am covered very nicely. So the main class will always, we'll take the class like exam oriented topic. Like we'll shorten the topic and we'll finish it as per exam. Don't worry. If you have any queries, contact with us. And if you have any doubt also, you can contact with us. Thank you so much. And we will post our flyovers, everything in the group. Hello? Hello?
Hello?
Ilakya ma'am.
What, sir? நான் லீவ் பண்ணிட்டுமா?
Okay, ma'am. Thank you. Thank you so much.
Thank you, sir.